Hello, everybody. My name is Pawan Rajpal, and I'm a consultant psychiatrist. I practice out of Holly Street in London and Priory Hospital in Bristol. Today, we're going to talk about fear. Why is it important to talk and think about fear? Because if it causes problems, then it will control your life. You will live in the fear of everything. Usually, it's a natural, powerful, and a primitive human reaction. It has biochemical and emotional components. Sometimes it's a good thing because it alerts us to the dangers or the threat. It makes us act or take a flight so that our life is saved. When fear is secondary to real threats, it can save our life, it can protect us. However, in some cases, it is also a part of mental health difficulties like anxiety, post traumatic stress disorder, social anxiety, phobias, and then it starts causing problems in our real life. As I said earlier, it has two components. The biochemical part, our brain, when exposed to a risk issue where there is a threat to ourselves, releases some neurotransmitters like adrenaline, which increase our heart rate, increase the adrenaline. This response is known as fight or flight. Our body prepares to enter combat or run away. It is an evolutionary development, it protects us. There's also an emotional response. It's very personalized, unlike the biochemical response. The emotional response is very specific to our growing up, our experiences of trauma in the past, how we respond to it. You might have heard of adrenaline junkies, where this spike, when we come down from it, gives us a sense of high, or when we watch scary movies. This can bring about a sense of liberation, lightness. But we should never forget that fear is one of the strongest emotions that we know. It, in emergencies, can protect us. It becomes a problem when it happens without our control. It becomes a problem when it starts controlling our life. Some of these fear responses can be called anxiety. So, a short spike in fear and anxiety with a threat to self can be called a panic attack. Fear of failure, hence avoiding people, talking to people, going out in crowds, can be a part of social anxiety or agoraphobia, and other phobias. It controls our life. It takes away the sense of enjoyment. It changes who we are. And hence, that is why fear is a problem. Too long of being fearful, being anxious can overwhelm us. It can cause secondary low mood, depression. We can be afraid even to think or act in any way. It can stop us from living. In my practice, I have seen many cases, many people whose life has been destroyed or so controlled that they cannot be who they are. So, what can we do about it? Let's talk about those cases that can be translated to them being caused anxiety. There is subtle difference between fear and anxiety. Fear can be thought to be a joint response, whereas anxiety is mostly psychological response to an overwhelming, to an impossible situation that we might find ourselves in. It's extremely important to remember that all of us can be fearful, all of us can be afraid, but this is about the fear, the being afraid, the anxiety ruling us, controlling us. So, how does it feel like it? So, let's start with this. Your brain will feel confused, chaotic, your heart will go up, you will feel your heartbeats going too fast or being unstable, your breathing will go fast, your muscles will become very tense, you'll sweat, your stomach will churn, you will not be able to concentrate, you might feel dizzy, you might feel frozen, your appetite will go away. Some of these things happen because our body is preparing ourselves for an emergency. Uh, there's increased blood flow to our muscles, increased blood flow to our heart. This is sustainable only for a short duration of time, because after that, it starts affecting your life. It starts affecting who you are. Your mood drops, you feel tired all the time, you might have headaches, your sleeping gets disrupted, you might have a decreased in your libido. Life just becomes difficult. Life just seems out of control. And that is where we need to work on. Though appreciating that fear can be an important part of growth, it can also give us extra edge. But prolonged fear starts affecting our day to day life. So, what does really cause fear? Now, that's a very complex question. I'm going to focus on things from past that will lay down the groundwork for what scares of makes us fearful all our life. Let's take a few examples. For example, being fearful of certain objects or situations like spiders, snakes, heights. Uh, these are called phobias. Uh, there are certain fears that are innate, a part of our evolutionary growing up. I have in my practice seen fears from past experiences. In my practice, I have seen our past experiences are the biggest factor that caused people to become afraid. We tend to live our lives day to day going through the patterns of what we did in the past, impacting us in a more negative way every day, controlling our lives and making it worse. It's extremely important to appreciate that the first step to overcome such fear is to accept where it's coming from. And once you do, then we can, of course, address it. There are good scientific evidence that when one is exposed to a life threatening event, certain neuronal pathways or connections are set up which are the basis of future episodes of fear or anxiety. Once we have taken the step of recognizing that our past experiences might be playing a role, might be a factor in the way we are feeling about ourselves and our future. Because these past experiences almost set up something like a memory, and then we replay that memory again and again and again. There's a part of our brain called amygdala, which is where our emotions sit. And we know that there are structural and connectional changes in case somebody is exposed to such a past difficulty. It's extremely important to remember that fear affects the way we think, the way we feel, the way we live our life. It affects all our parts of life, it affects everything we do. The important part to remember is that we can modulate this fear, we can change the way we feel. I'm going to do further talks on this fear. I'm going to do further talks on sharing what you can do sitting at home to overcome this fear so that people can listen and understand where fear is coming from, how it's affecting their life, and what they can do to overcome. Thank you so much for listening. Have a very good day.